I'll start with just the statement the movie started out with, which says, religious involvement is good for your health. And it was a pretty bold way to start the movie, I thought, because at first I'm not a particularly religious person. And I, like many, probably everybody, has had to cross paths with the healthcare system in some pretty intense ways in my life. So, I guess, could you just address that statement as, in and of itself, if I am not involved in religion, it strikes me as a little bit aggressive.
I think we have to really look at this from multiple perspectives. One of the things that we are talking about is if the patient is religious or spiritual, that is a major, stabilizing force as well as strength that they can rely on to be able to help themselves out. And so one of the statistics that was being said, those who have those kind of beliefs have at least, one study, 8 years of life difference. That should give us all a pause, in terms of what has that in effect. It does not necessarily mean those who don't have the belief does not necessarily, cannot be supported, because there are psychological ways that can be still supported. And there is the concept in terms of love, which has nothing to do with religion, is still a major component that is there for the individual person in terms of how they do. So in terms of addressing as what has been observed, and I think Dan says there in terms of there is a groundswell of, in the last 15, 20 years, of a recognition of this has some effect in terms of health of individuals.
Okay. Can I ask you, Christina, do you mind if I call you Christina? On that note, you, as I said, were a founder of this center at GW. You're sort of a pioneer in this area. I imagine that you had to overcome some real resistance and barriers to get some academic acceptance to mixing the idea of faith and medicine.
So I'd like to answer that first by saying it's broader than faith.
Okay.
And so I do think that was a bold statement at the beginning of the movie. I think it's a lot of our work, and I'd like to acknowledge Dr. Jim Blatt, my close friend and colleague and a professor of medicine at GW, who has worked with me on this curriculum development, and I can say he's an agnostic and looks at it broadly, as I do too. So I think it's important when we look at this area that it's not just religion, but maybe the broader category of spirituality. In fact, many of the policy guidelines are around that. So I think looking at spirituality in general, and you hinted at it, there's many aspects to meaning and purpose and connectedness to however people see significant or sacred. But yes, getting back to your question about the curriculum, in the early 90s, when I proposed a curriculum to the dean in our school, there was a lot of skepticism, in part because of some what Dr. Sloan talked about too, that it isn't just a place to bring up only religion, but to really explore what spirituality means in a person's life, in their connectedness. Many patients who I'll identify with religion, but what they really talk about when I do a spiritual history is their family or their sense of how they are able to transcend hopelessness and deep suffering in many different ways. And so I think there was certainly a struggle at the beginning, and I think over times, doing it in a very credible way, working with the Association of American Medical Colleges, again, defining spirituality as a common to everybody. Everyone has a spirituality, and it can be expressed in many different ways. And the film actually shows that. You see religion as an expression, you see music, the arts, you see love, the powerful relationship. So spirituality, spiritual care is not just about asking someone about their spirituality, but how we bring our own presence. The chaplain showed that, all the clinicians do that same to the encounter, the loving encounter.
And there was a very specific scene that you and Dr. Smolzi, where you were talking to either young doctors or interns or students, and I was interested in how, is that something you do with all of your young doctors? And do you encounter resistance or acceptance or discomfort or all of those? How does that work?
Yeah, I think there is sometimes some discomfort even among the students and interns and residents. Partly maybe they get that from their professors and the sort of diet they get of pure science during the rest of their education. But I think, these are young people who are experiencing patients who are sick. And they know that this is, in their heart of hearts, this is a sort of spiritual event for those persons. And they experience the kind of love that some of those other older doctors were talking about as well. And so when you, as I said, break the barrier, you break the ice and begin to talk about it, as you saw in the film, they opened up, and even the young intern who was an atheist, was very grateful to hear that she could talk to patients about their spiritual needs because she respected them as persons who were spiritual beings struggling with their health care.
Okay, and I'm just going to follow up on that because in that scene, you were all talking to a young man who was an alcoholic and was very hostile toward the idea of God at that moment. And when you were talking to your interns afterward, you suggested that was bad for his outlook. At least that's the way I understood what you were saying.
Yes. So when you hear that overall religion, is good for your health, as you heard from Dr. Koenig at the beginning of the film, that's a broad statement about people attending religious services living longer. But the story is much more complex than that, right? That there are people who are very religious who, as that patient in the film suggested, are estranged from God. There's something called negative religious coping, which can be very bad for people. They feel God's punishing them. But the problem we have in medicine is we don't ask that question. Right? We never get to what's really bothering that patient. There have been cases I've experienced where patients who have HIV have not been taking their medicines, and the doctors are pounding on them, why aren't you taking your medicine? It's good for you, and it'll help your healthcare outcomes, only to realize that somebody finally asked the question, the reason the patient wasn't taking the medicine was because they felt God was punishing them, and they deserved to be sick. And it was only through the intervention of a chaplain that the patient could start taking the medication because he'd overcome that negative religious coping.